It's only a little bit. Here we see a slight, only small. Are you guilty of saying any of these things when you're going over x-rays? Hey, MedPro Dojo family, it's Sensei Tosh. I had to get on today because I did a call earlier with a doc and we were going over his x-ray presentation. And one of the things that we pulled out was some of these words that I hear many of you guys saying through the recordings on the report of findings. Oh, right here, you see it's just a little bit of degeneration. Discs have narrowed just ever so slightly. Don't minimize what's there. Is there degenerative changes? Then just say, look at the degenerative changes that are already happening. Look at the disc narrowing that's taking place here. Don't minimize, don't use minimizing words. The example that I gave to him today, how would you respond if your primary care doctor or an oncologist said, take a look here, there's just a little bit of cancer. It's not that much, but there's some cancer right here. Most people would freak out knowing that they even had any hint of cancer. We want the interference, the degeneration, the disc narrowing to come with the same amount of weight and authority as if somebody had abnormal cell growth cancer in their body. Some of you will say, well, no, that's not the same thing. It's not scare tactics. No, we're not using scare tactics, but we are letting them know that it's there. The other example I gave, if you went to the dentist, they wouldn't say, oh, we just see a little cavity there, we're just going to watch it. No, they're going to tell you, you have a cavity in your tooth. We need to schedule you for a filling. If you asked your dentist, well, could we just leave it and see what happens? What do you think they would tell you? No, because if you leave it and that cavity gets worse and it hits the nerve, you'll either have one of two options. You get the tooth pulled out of your head, or you have a root canal and then you have a crown put on it. So you could have had a simple filling, or now you either have a tooth removed from your head or you have an extensive procedure and an expensive crown put on your tooth. So some of you may think that's extreme. It's not, because it's the same way. If people have degenerative changes, they have disc narrowing, if there's pressure on the nervous system, we know that the life force decreases, the body's ability to heal, maintain, and regulate itself decreases. The body goes into a state of dis-ease and dysfunction, and if left over a period of time, it will become disease. And that's what we're looking to avoid. So stop being afraid to say what it is that you see. Get people engaged in going over the x-rays with you. Ask them questions. Do the education ahead of time. This is what normal should look like. A nice curve, equal disc spacing, no signs of degeneration. When we see in phase 1, what do you notice that happens? Ooh, it doesn't look as curved. You're right. What do you notice here in phase 2? They're like, oh, it kind of looks like a bird beak, or what are those things? Well, what does it say here? Calcium deposition, bone spurs. Educate them. So then when the doc comes in to go over the x-rays, they'll say, what here on your x-rays look like degenerative changes? And the patient will go, oh my gosh, right here and right here. So let them be part of the experience. So stay away from minimizing words. People will minimize. That's why it's taken them so long to even make it into your office, because they want to minimize and justify, oh, it's going to go away. It'll be better tomorrow. It'll be better next week. And that's where the biggest damages that can happen in the body take place, because we minimize and we don't look at the importance of it. So it may be extreme, but you would never hear an oncologist say, oh, we just have a little bit of cancer. You would never hear a dentist say, oh, it's just a little tiny cavity. So don't say that as a chiropractor. Don't say that in your chiropractic and medically integrated facilities. People have to feel the weight of what is going on, because they won't change it until they do. So stay away from minimizing words. Say what you see as it is. I hope that helps. Be blessed and be a blessing. We'll see you next time.